Okay, welcome to House Human Services on Tuesday afternoon. We're going to be taking up pre-kindergarten and our committee's input into the continuing implementation of Act 73, which, as y'all know, was passed last year. So before we do, first off, the Agency of Education witnesses were not able to come today. They canceled at the last minute, and so we are looking to hopefully get them back tomorrow. We'll see. I am still hoping that we have something out of this committee by Thursday because other committees are awaiting our work. One of the things that I just wanted to do before we launch into testimony this afternoon is just to set the stage a little bit about, what are we doing? And what should we be thinking about as we listen to testimony and as we ask questions? And we've had some preliminary testimony already from Dr. Crossman at Building Bright Futures and the national folks about where, Vermont stands, and from Ledge Council, and of course the JFO report. So they've been spread out over several days, so it might feel like, oh, we're just starting pre-K. Well, we're not just starting pre-K. We've been doing it for a little bit now. But several of the things that I'd like you to keep in mind as we think about this, and I'm going to harken back to Act 76, which is where the Pre-K Implementation Committee was charged with looking at and making recommendations about pre-K. So one of the things, I'm just going to give you like 3 or 4 things to keep in mind. One, we've heard testimony about a mixed delivery system, public and private. And so that's a question we need to answer in our bill. Should we continue with a mixed delivery system? And the other option is public only, or I guess private only. So right now we have a mixed delivery system. Should we continue in that vein? How do we increase equity in the state in terms of equity to access for children who do not have access to pre-K right now? We saw in testimony last week, only 11% of eligible children in the Northeast Kingdom have access right now to pre-K. So how do we increase equity in the system? How do we assure that there is more equitable access? Are we able to increase the number of hours of pre-K that we are able to provide? And to do that without costing the Ed Fund more money, essentially. And how could we do that? Or can we do that? We don't know, but we will be getting information from JFO about that. I'm also going to ask you to consider whether we're doing this for 3-year-olds and 4-year-olds, or whether we're doing this for 4-year-olds and looking at 3-year-olds and obviously continued access to CCFAP. There have been questions in the building over time about public education dollars going to private entities. And I think one of the things that I'm hoping maybe our current witness is able to share with us is some of the things that I've started to learn is that there's actually dollars going the opposite direction as well. And there are more schools that are taking up CCFAP as a potential source of funding to narrow the gap for the programs that they have in pre-K. So it's not easy answers to the questions, but those are the kinds of things that I would like for you to be thinking about in terms of questions as we go through this process over the next 3 days, and be thinking about the information that we've already received. I think it's important. We did hear from Dr. Crossman information that we had not had access to previously. That was fabulous from my perspective, and it answered some of the questions, so of course, not all the questions. And if there are other questions that you think need to be answered in this area, those are things to be bringing up as well. And we might not have sufficient time to answer all of those questions, and there may not even be sufficient data to answer those questions. But what should we expect from the Agency of Education and the Department for Children and Families in terms of data on pre-K? So things like what constitutes a full day? Things like which schools are offering how much pre-K in the public sector? Which schools are not offering any pre-K in the public sector, and sort of like all the variance in between. And, where should we have a targeted focus in areas of the state? Even before we think about, is there potential to expand pre-K? Does that help frame the issues for folks? Yeah.
I'm curious, I'm not sure I understood the point you were making about how there's been a discussion about public dollars going to private entities, but you said money is also going, or things are going the other way. Can you expand on that? I wasn't sure I understood.
Well, I've started to learn that school districts are becoming and applying for, and we'll hear from the witness, but the CCFAP money. So there's been this discussion about public education funds only in public schools. And so there have been some people in the building who said that we should keep it pure. That's the way it should go. And of course, we've heard a number of folks talk testimony to us already about a mixed delivery system being best practice. And I didn't add to that other thing. We're doing well in terms of some of the indicators in terms of overall access when compared to our other states, but also in terms of readiness for kindergarten. And we don't want to upset the apple cart. So the other fund, the money going the other way, I was talking about CCFAP funds going into public schools, whether through a contract with a private provider in the public school, or I'm learning about some public schools themselves starting to tap into CCFAP. And so I don't think that there is there's wide knowledge of when I said the money going the other way. So there's money going both ways. I think that the perception has been there has only been money going in one direction, and that's from public education funds into the private pre-K. And in reality, there's money going in both directions. So, okay. Thank you. Thank you, Deputy Commissioner McLaughlin. Welcome to House Human Services. Glad you're not hopping around.
Yeah, I got matching shoes on now.
Yeah.
So, happy to be here. Again, Janet McLaughlin. I'm Deputy Commissioner within the Department for Children and Families, oversee the Child Development Division, which is sort of all things childcare licensing, childcare financial assistance, childcare quality and capacity, and also children's integrated services, which is really early intervention and other supports for children primarily under 5 who need some additional developmental supports, both at home in their childcare program or potentially in their school. So I sent over 2 things because, we were at this, as we all know, we've all been kind of flexible right now, trying to be flexible on scheduling and things. So there's both, what you guys have both is sort of longer written remarks, and I have a few slides to try to guide the conversation. I have, reviewed notes or listened to most of the testimony that you guys have heard already. So hopefully I'm be ready to answer most of your questions. And I think like the biggest picture thing I would like to say is there's 2 things about that. One is that I think Vermont should be really proud of everything that we've done, right, for children under 5 and for pre-kindergarten education in the state, right? We are, a leader nationally, and we should feel really proud of what we've developed. So I want, and I have, let's see, make sure this goes forward. And I know that you've had testimony that has gone over the basics of pre-kindergarten, so I won't do that, but I put I do have this slide that just goes over some of the 4 key elements, right? As you're thinking about, again, what are the factors that you guys want to make sure you're considering? When it comes to pre-kindergarten in Vermont, I look back, right? 1987 is when Vermont started allowing public schools to start serving 3 and 4-year-olds. 2007 is when that was, and that was more like a grant program. 2007 is when schools were allowed to start building that into their school budgets and just start serving 3 and 4-year-olds. And then right before Act 166 passed in 2014, the state had realized that some school districts really took on the opportunity, took the opportunity to serve 3 and 4-year-olds, and others did less. And so you did have a lot of inequity in terms of access before once before UPK was established. I think the number, I didn't go back and check this for statistic, but I'm thinking the number was sort of like 40% of children had access to pre-kindergarten education. And so 166 was created was passed, right, to provide greater equity and access. And now we're at about 70%, right, of age eligible children. So really, it's accomplished a huge part of what it wanted to accomplish. But we agree that that we can strengthen it, that we can grow. We really want to build from this foundation that's been laid right now. My understanding sort of the decision at the time and sort of our current view of it is it's really about setting what is sort of the minimum standard of saying we want all children to at least have access to this minimum number of hours. That's been something that has, and that allows sort of school districts and others to make sure they have eyes on, more children before they're showing up in kindergarten so they can get identified for services so that their families can get extra supports if that's what they need. And so they can be exposed to some of the, social emotional development, the early literacy, early math skills. So that, it's a tiny history lesson. Publicly funded, inclusive. And so portable was the new thing that was really added, I think, with Act 166. And so with universal pre-kindergarten, right, was recognizing that some school districts hadn't taken up that opportunity. Families really wanted families, and also many families needed needed full-time care, needed full year care. They might be in a high quality early childhood education setting already. And so if they're already there, why take them out and deal with more transitions, but instead let's make sure that more kids have access there. So that was that change and mixed delivery. Again, some of this with the change that happened in 2007, some school districts were already contracting and partnering with different in their community to meet the needs. But it was very different across all the different settings. And so Act 166 aimed to standardize that. And it has in some ways, it standardized it kind of, I think, for the community-based and private and nonprofit programs, right? In terms of some of the standards, in terms of the hours, in terms of the payments. But on the public school side, because it's been built into school budgets, right? Schools have a lot of, right? We know have a lot of choice in Vermont, right? And they have a lot of self-selection. And so some school districts have chosen to raise, right, additional revenue and to invest additional funds and invest additional funds in pre-kindergarten beyond what the minimum, beyond the minimum 10 hours. So I think that's sort of why we've ended up with one funding structure, right, for community-based programs, and a different funding basis in many places for the public school-based programs.
Are you okay with people asking questions as you go?
Yes.
Okay. So I have a question about that because about some school districts deciding to provide more, and some none,
Right.
and lots of variations in between. As we think about new policy for pre-K, because that's what we're about to entertain.
Yeah.
should it be allowable for school districts to build budgets that include more than, or should there be a sort of a standardized amount? Or should we, I mean, a cap that for which you would receive,
Mhm.
we're talking about changing the financing system part of this as well.
Yeah,
Should there, I am trying to attack this equity issue on
Yeah.
multiple fronts. And while in the same breath that I say that, I know that some school districts may have greater needs for some children at that age than other school districts may. And so the question, I realize, is not a simple question, but I feel like we continue to have issues with equity if we're not setting some standard someplace.
right. So, and, let's see. I'm trying to speak, like, I can't like necessarily like speak to a policy question that I haven't like reviewed with, like, because we don't have like a bill to respond to yet, officially, but I did. Sorry, but I mean, we agree that we want to try to tackle the equity issue more, and that we need to make sure that there is, and ideally we'd be figuring out, I think, from those school districts who are doing, or, regions, right, that maybe have partnered together that are doing a really excellent job, to sort of look at what those practices are and how can we support that happening in more parts of the state. I agree. It's this balance, right, between what local needs are, right, and how are we doing? I mean, it's you and everybody's dealing with, right, in terms of, and how do you do cost control? I think with the switch to, with the changes in funding proposed in Act 73, I mean, that would say this is the amount, right? Not that you get to just choose, and you can, and then once you have your amount, right, you can make your choices about how you, some choices about how you want to spend it. But I don't think it would, I think that will allow some of that. And I do have one slide that speaks a little bit to that.
And we are considering categorical aid for pre-K as opposed to, the average daily membership, conglomeration. Representative Eustace?
So in this same vein, I don't know, can someone speak to the idea, are there districts where there is a public program and there are also private programs? So choices are available there, and do we want to get into speaking about that in any way in this process? Or
Well, I think that that's one of the questions I just laid out,
Yeah.
So do we continue with the mixed delivery system, or not, and.
Well, I get that we call it a mixed delivery system because it's all over the state, but
No, mixed delivery means that part of it is public and part of it is private.
right,
That's
but
what mixed
in the
delivery.
same community.
Yes, oh, yes, absolutely.
Yeah.
Okay.
Right. And that ends up being one of the challenges that comes up, right? Because a school district needs to work with a bunch of different partners and run their own program, but community-based programs might need to work with multiple school districts.
Right.
So it's people have flagged the administrative complexity, and it is real.
Yeah, it is real. And I think that one of the, so when I think about the equity question, again, I'm just gonna, hopefully people from Winooski, don't think I'm really singling them out, but it's the one that pops to mind most. So Winooski has, or at least they did when we were taking testimony in Act 76, a full-time pre-K. As compared to, don't ask me what full-time means because
It varies.
But they offer more than 10 and something more comparable to what the other primary students get, the other elementary students get. But if you got pre-K in the private setting, you're only going to get 10 hours a week in Winooski. So right in the same community.
Well, you're only going to be funded.
It's
You're only
the
gonna fund
funding
it.
piece, right? We're
Right.
talking
Yeah.
about-
And the
I mean,
private
care would
is
be
not.
available for additional hours, but you would either have to use CCFAP or pay for it in some other way.
But it's not pre-K.
It's not
Right.
pre-K.
It's not necessarily
Well, it's
the
not
pre-K.
pre-K, it
It's not
becomes-
necessarily the pre-K quality level, and it's not necessarily, and it's not funded publicly through the Ed Fund.
That's right. And that makes that makes a difference.
Yeah.
So,
Mhm.
go ahead.
And that's where I'm confused. So where does the money come from?
There's two sources of funding right now. And there's only one source of funding right now. For pre-K, it's in the ed fund.
But that would be taxpayer dollars?
The ed fund, you pay your property
But would
taxes,
it
that's
be
where it goes.
additional than what's already there?
No, we're not talking about anything additional right now. We're just talking about what the current system is.
This is where I get confused though. When we have to vote on something, we're not given a dollar amount. And right now with all the stress of people not being able to pay their taxes, how can we vote on this?
Brenda, I'm not talking about increasing any costs right now. We're just
Okay.
talking about we're just
Okay.
talking about what the current system is.
Okay.
Just to
We
understand
won't
it.
vote on this unless we get a dollar figure.
We're going to have testimony from JFO later this week.
Thank you.
You're welcome. We haven't gotten off slide one.
Yep.
I
I
think
moved this slide too quickly, but yes.
I'm just trying to learn.
No, that's, I just want to make sure that the witness has a chance to say everything she wants to. I started it, so I know.
On this question of the mixed delivery in the
Mhm.
public school setting versus a private provider and looking at this JFO report, talks about if the triggers of Act 73 are met, then
Yeah.
we'll call it a $6,900
Mhm.
figure. But currently, private provider receives roughly 3,900.
Mhm.
Currently, what does a public pre-K receive if the student is educated in that district school setting?
Well, it depends on what they put in their school budget, right? Depends on what that community, my understanding, somebody else who knows school finance better than me, right? It depends on what this, right? It's what the school put, the local district voted
Yeah.
on, and then
I'm
it's
just
divided by the
referring to
ADM.
JFO presentation
Yeah,
that we had back a month ago.
That
so,
includes off of their
It's,
report.
yes, but in the slideshow, they bulleted it and showed.
yeah, so it does average to about that amount. I will offer you that.
Yes.
But it could be very different in different communities, again, based on what they passed in their budget. And then-
Lucy's getting more than some other school
Well,
that's
it's
not on.
also probably using some of its Title I dollars, right, for being a.
Right, combining it.
Mhm.
Yeah.
But it appears, and I'm trying to figure out
Yeah.
if this is the case, why it would be the case, that if we go with the standard 10 hours a week
Yeah,
in a public school setting versus a private setting, the dollar amount received by the public school is different than the amount received by the private
Yeah.
provider.
so I was starting to touch on that. So, and I don't think I have a slide specifically on that, but I have something in this written testimony thing I submitted, which is just, I mean, and again, it has to do with it. When 166 was passed, and this is about when I started working in early childhood in Vermont. So I remember I joined like the first year, I joined this field in the first year of full implementation of 166 and was really connected to the Vermont Community Preschool Collaborative at that time. So, but it essentially the committee that was the interagency committee that was doing the planning for 166, they looked at, they got estimates for how much it would cost to offer 10 hours of high quality pre-K. That amount was about $3,000, and then it's been set in an index. And it's just been increasing on that index for 10 years, but perhaps the underlying cost structure hasn't been like re-examined in that amount of time. But also at that same time, the schools were not bound by that same index, right, in increasing the amount that they were spending on pre-K. And they could be increasing for a variety of reasons. They could be increasing because they were offering more services or because they offer a fuller benefits package perhaps than a community-based program. So they just weren't moving in sync with one another at all. Like there was no mechanism for them to move in sync with another. And I think that is something that I have definitely talked about with leadership at Agency of Education of like figuring out how we do get those synced up so that more so that there's more equity between the settings. Does that help answer the question?
It does.
Okay.
So,
That would be one of my goals, I'll be honest,
Yeah.
is that we have the same payment to private as we have for public. Public would get an admin addition because they have to manage the contracts and they potentially have a pre-K coordinator and stuff like that, but,
Mhm.
But the per pupil cost, the per pupil spending would be the same in each situation.
that's one of the goals.
Yeah.
And
It seems important if the committee decides to move towards and maintain a mixed delivery system, that seems like that would be a key aspect of maintaining that.
And we certainly couldn't require a licensed teacher in the classroom unless we increase the amount going to the private to be comparable to what's being done in the public. Yeah. Anyway, all things that are up there. Yeah. Yeah, go ahead, Representative Cole.
Well, maybe this is follow-up for when that conversation happens, but like you said, you know, needing to pay teachers more, but also at the same time requiring that licensure is a part of that. So like,
Yeah.
just if, you know, we are showing up the funding that we're also showing up, like, it's, I don't want to say expectations, because, you know, childcare is.
No, the qualified staff, the qualifications of staff would
Yeah.
definitely be part of that.
And other things that, you know, we put on our public schools in general for criteria to make sure we're providing equitable access to education. So just making sure it's all lining up.
Yep.
Yeah, which we'll talk about.
Right, and I think that when 166 was passed, that was part of the discussion was that part of the priority was on universal access at the time and if they had moved directly to requiring AOE educator licenses across all settings fully at the same level at schools at that time, then they wouldn't have been able to achieve some of the expansion access goals that they had. Partially just because, right, people who were working in community-based programs, I mean, some of them might have had a master's degree in early childhood education, they just didn't have an AOE educator's license, so they needed time. It has been 10 years. So that's totally valid to reopen this question. I will offer that in the pre-K committee report, there are several pages devoted to this issue. It looks at the quality standards for pre-kindergarten education. It looks at the NEAR standards. So you heard from Gigi last week, right? And then it looked and compared it to the NEUIC standards. And you heard from Sharon, right? Who's with the Vermont NEUIC chapter. It also compared it to the Head Start standards. And I think you hear from Christy next. So you guys will, all of those standards were compared across, and looked at how are we doing across settings. We're doing pretty good. Again, we do. And then it went more deeply into educator qualifications, both lead educators as well as the assistant educators, and really outlined, where we stand right now. And then explored the concept of when we look at other states that have made some of these changes, right? What were some of the supports that they put in place? And what is the transition timeline? And so I think that's for us, as I know that you guys are really motivated to get a bill out. And I do think we really honestly are pretty directionally aligned with what we want for children in Vermont. Within the bounds of reality, our budget realities and all of those things. I think we just do need to acknowledge there would need to be transition time and the resource questions and that they all interplay together. So again, this quick overview slide is I wanted to talk about a few things here. So first, and I have slides on, for the 3 bullets there, I have a few slides on them. One is just really quickly related to Act 73. The next is just to make sure you guys know what's happening with a preschool development grant for the 5 project that's funded this year. And the next are just some bullet points in terms of considerations for UPK design, which I know you've talked about, but I had some thoughts I wanted to share with you about that. Again, big picture, right? All of this is part of from our perspective, right? Part of this cradle to career vision for Vermont, right? To create, and part of that does include a robust, equitable, high quality, publicly funded pre-kindergarten system. And we do believe that some of the changes, right? The changes in Act 73 that would can improve the effectiveness and efficiency of UPK, right? In terms of fewer districts would ideally allow for better coordination and support, allow us to get a little more clear on the resource allocation, because when you have, right, one group is figuring this out for 500 students, one group is figuring this out for 50 students, right? You're well, what is the overhead that's needed? How do we think about that, right? That ends up being one of the challenges. And it makes it tricky to think through how are we supporting the governance. as the administration, like our perspective is really like some of those key decisions around governance and funding for the public education system overall really need to be made before to provide that clarity on how to adjust our pre-kindergarten program. We really need to know what we're hanging the pre-kindergarten structure onto. So that's the big picture. I think, and this is just making this map, right? I know you guys saw different data from Morgan, which again, she did a good job of giving us shared credit because definitely AOE, CDD, and BBF worked together on those maps and data that you saw last week. But again, this is just to, again, paint that picture of, right, when you got 20 students in one district and you got 486, like just how you organize things is just going to be different. And the other thing I wanted, I'm sure you guys know, I mean, you passed this bill. So for Act 7325, right, it does talk about that there's a funding study that's due in December from JFO that talks about recommending the CALS factor formula for special education weights and disability categories, but also to update any other weights determined to be empirically necessary for an adequate and equitable education. So from our perspective, this study is the place to figure out what we think is where to set new weights, to make sure that we're coming up with the funding formula that we want. And that there already is a legislatively mandated mechanism in place to address the equitable funding formula. So that's what I personally had to say related to Act 73. Another thing I wanted to make sure that you all know, and I know it ends up being a lot of words on this slide, and I'm actually going to read some of them out loud because I think they're really important. Again, we did. I just also want to like remind people, right? Like the pre-K committee report came out in December of 2024. So in the months leading up to that, that was like, oh my gosh, what are we doing for education transformation, right? And then as you guys remember, a year ago, we were all like, what is going to happen? Is our federal funding, what's going to happen, right? We were all really worried and concerned about that. And it was a really difficult time to make plans, right, related to those pieces of it. And one of the pieces within that was this preschool development grant that is and it's preschool development grant Birth to 5. So Child Development Division has been the applicant for this funds because it is supposed to be for the Birth to 5 system. And again, that was something that the request for a proposal, the notice of funding availability was supposed to come out from the federal government by like June, July. We didn't get it until like November and like mid-November, and we needed to turn around our grant application in like 5 or 6 business days. So it's, this has been very much on our minds, and I just want to remind all of us, like, it's been alongside some other heavy things, which I know you guys know, but just mentioning that. But we did it was on our minds, and we were ready when the application finally was released for us to say, we know what we want to do to answer some of these key questions around pre-K. And so we, CDD, AOE, and BBF are leading on a project around UPK systems alignment. We put out a request for consultants, and we reviewed bids yesterday. We got a lot of really capable, qualified organizations wanting to help the state of Vermont with this for small fee, and we are with PDG funding. And these are the goals that we're going to be working on, again, with the goal to have a an implementation plan of recommendations by December. So again, I think these goals are the same as yours, right? Improving access by ensuring UPK policies and supports work consistently for families, and across the state and across program types. We know that we need to sort of clarify and align UPK governance and expectations across agencies and settings, right? So that public schools, community-based programs, family, child care, head start, everybody's operating within what feels like a really coherent framework. We want to reduce the administrative burden and duplication by identifying if there's any places where there's unnecessary differences in oversight, monitoring, and reporting. And again, we want to create that foundation for shared UTK data governance and integration so that Vermont can track, participation, quality, outcomes across the mixed delivery system using consistent definition and low burning processes. So I just want you to know we are committed to these goals. We have secured resources to do it. Staff across CDD, AOE, and BBF, have all set aside time to prioritize this work in the next year.
That's great. I mean, we heard the same thing from Building Bright Futures, and I'm hopeful that we'll hear the same thing from AOE.
So and then I wanted to flag a couple of things that I know you are aware of them, but I heard some questions about it. So, and you'll hear more about it, but again, interaction with the Head Start program and funding model, right? We have, there's $28 million or so of federal funding that comes in for some of the highest need children in Vermont through Head Start. Head Start is a model for 3 and 4-year-olds. And any changes hopefully would not impact, right, children who are eligible for Head Start's access to the full family wraparound services.
Does that money come through you?
No, it doesn't. It's direct.
That's what I thought.
We just have we host the Head Start collaboration office with our Head Start director. And so we have an eye on all of it, but we do not, the money goes directly to those grantees.
Okay.
And then they are using, there's a matching requirement. So universal pre-kindergarten or child care financial assistance can be matched for some of those pieces. And there's just some really excellent, really excellent community school district, non-Head Start community spots, Head Start, and school district partnerships in different parts of the state that are connected to the idea of built on having both 3s and 4-year-olds in that community. If we start pulling one string, it's going to have an implication for that structure overall. And so I think that needs to be done pretty planfully. The second piece is around early childhood special education, right? And that is legally mandated to be offered through the LEA, through the school district, starting at a child's 3rd birthday. So Children's Integrated Services serves children with early intervention from 0 to 3. And then we have some other family support, specialized childcare, some other supports that wrap around that go up to 5 and maybe a little older than that. But the transition for early childhood special education is the 3rd birthday. So school districts are responsible for making sure that children get early childhood special education. And the best practice is to have children in their least restrictive environment. And so for many schools, having a classroom that includes maybe a typically developing 3-year-olds as well as 3-year-olds who are eligible for early childhood special education, as long as not more than 50% of the kids have disabilities, then it still is that least restrictive environment, which fits what we know as best practice, right? In terms of creating a community of peers, both for all children, right? So that's definitely an important consideration as you think about ages.
And I just want to be clear that I don't envision us, messing with any of that stuff up there. In terms of, it's not, we can't do anything about Head Start, nor would this not under our purview. I understand it's a blended and braided funding system. But we also, for instance, because on the table is whether 3-year-olds continue in pre-K or not. And so that doesn't mean that they wouldn't be eligible for special education. And it doesn't mean that they wouldn't be eligible for high quality childcare and, funding under that.
Right. But the school district, if the school district wasn't allowed to serve 3-year-olds in wasn't allowed to offer pre-kindergarten education for 3-year-olds, then the school district would no longer have classrooms that serve typically developing 3-year-olds to include those children who are eligible for early childhood special education services in it. And it already is really challenging to coordinate early childhood special education services within the mixed delivery system. And so this would be eliminating one option that many school districts are use to achieve those goals. You know, in the pre-kindergarten education implementation committee report, in the appendix, there was surveys that we did of school districts around what would they, you know, if it moved to being a full day 4-year-old program, or it moved to being just 4-year-olds, like what would that mean? Would that have to change how you deliver early childhood special education? And they said yes. Like, they did not say no. They said yes. It will change how we have to deliver special education. And they weren't sure how they were going to do that. And they were concerned about their ability to best meet the needs of children and to connect them with the special services that they provide, as well as giving them you know, in a natural environment, essentially, for those children, right? Rather than just having them come in and work on one-on-one, right? The best practice is to have somebody ideally like in the classroom with that child and like helping them supporting them in some place that's a natural environment. And it's also more time and cost effective for the districts as well to be able to do that. And it really depends on, you know, again, we know it does depend on the district, but the districts that are taking a planful approach to this, or are looking at things at a regional basis with a mixed delivery system, you know, they are aware of what that pre-K gives them this place for both their 3s and their 4s to be aware of, like, what are the programs in their community? What are the services that can be offered? And there might be some kids that they would say that the school district might prioritize for enrollment in their own program. Maybe they're English language learners and they think that the district can support that better. Or maybe they're eligible for early childhood special education. And so I just am flagging, like, it would make a difference, I think. That's what our research showed. And that's what we've been hearing from districts.
I'm just, you know, when we heard from Mir,
Mhm.
Vermont is definitely an outlier
Mhm.
on their pretty little math.
Yes.
Shows Vermont and green and the rest of the country not. And when it talks about access for 3-year-olds, so other states other states have the same kind of
Mhm.
requirements as we do, and they're figuring out how to provide services to 3-year-olds, I would imagine.
No, they're not. Vermont is tops. Also,
I know we're tops. I know
we're about to
access.
We're also tops in early childhood special education, and you could get the early childhood special education folks in right there at AOE, right, to come in and talk to you about that. But we also are leaders in the nation in terms of providing early childhood special education in the least restrictive environment. So we're leaders in that as well. So then the other piece, this is all tied, right, is again the impacts on the early childhood education ecosystem, especially on infant and toddler care, right? We know that infant and toddler care is more resource intensive, just because you need more hands and more brains to support those, to support even younger children. And the way that has developed historically is that oftentimes programs are like, they might be thinking about how they are managing their costs based on the child from 0 to 5, right? So they know they're going to lose money on that kid when they're an infant or a toddler, but by the time they're in preschool, they're going to be able to have enough revenue that can cover their losses for that child when that child was younger. That's the way it has worked, partially because, right, those parents have not been able to pay for that in the level of resources that are needed for real infant toddler care. And that's the system that we have. And it is and it has been reinforced in the ways that child care financial assistance has been structured too, because that's has been based on market rates, not necessarily on, and it still is based on market rates officially, not based on estimates of cost of care. And so again, if we have children, if the incentives get structured in such a way that school districts are maybe offering certain kinds of programs, I guess, just be programs that decide to specialize in this, right? If the incentives are decided, are structured in such a way that that threes, fours, fives not yet enrolled in kindergarten are sort of peeled out of the 0 to 5 environment, it will leave a big hole in the budget for for the younger children.
When you say peeled out of the budget, what do you mean?
I mean, like maybe there'll be a program that, it could be that a public school decides to invest in full school day, full school year, pre-K at a different rate. And for a family, that's free. And so the family is going to go to that. And so they're no longer in their 0 to 5 setting anymore.
So anecdotally, we're seeing that happen already.
Absolutely.
And so I think, so this is kind of like one of the underlying questions. And I don't know if school districts, if we had a different funding system where pre-K wasn't part of the average daily weighted membership, so it doesn't reduce their cost per student. Whether like right now, it does. Whether that would sort of change that dynamic for school districts. But I think we're seeing an uptick in school districts looking at sort of all the different combinations of pre-K and CCFAP and all of that, and trying to figure out how to keep those kids in the school or to entice kids to come to the school. At least in the 2 school districts that I represent, that's happening. And so I think we're actually, depending upon the decisions we make here, are at risk of upsetting the very tenuously balanced apple cart of private and public pre-K right now. Because I think that because of all those things you just said in terms of, if school districts figure out a way to not have the disruption for the parents' schedule and are able to keep the kids for the whole day, whether it's some combination of CCFAP and pre-K and private pay and, all of the above. I think that the balance that we have right now that is tenuous in terms of those 3, 4, and 5-year-olds being in the private system and helping to offset the cost of the more expensive younger children could be upset considerably.
Right. And yes, and I guess the question is, right, and that's why our position is there's too many moving pieces right now to make a big change in pre-K right now. Like, I think in terms of hours, in terms of ages, like that's the administration's perspective, like maybe next year, but like right now, there's too many moving pieces and we could have some unintended consequences. Agree with you. We need, and it's different in different communities, because in some places they've got school buildings they need to fill, and in some places they got too many, they don't have enough spaces that would be developmentally appropriate for young children. So I think it's just something it's just like a really serious, I just want to say, like, it's not just like a theoretical question, right? It's a real one. So that was the main point. And we saw, California introduced what they called TK, which is really like transitional kindergarten. So it's kindergarten for 4-year-olds. Like last year or the year before, and childcare centers closed as a result of it. And there was less infant toddler care in those communities. And they found that most of the children who were newly accessing traditional kindergarten were children who had more resources. So again, there's like a cautionary tale there's cautionary tales elsewhere on this. And so that's all. I'm just saying, be cautious. Let's be cautious on this one. And I know caution sometimes leads us to just like not making any progress. So I don't want that. Like, I am motivated to make progress in terms of access for children. But it is an ecosystem.
And there might be things we can make progress on incrementally.
Yes.
In terms of, we might be able to address maybe 1.5 of the big questions, Go ahead.
I would say we're in a position where our progress is going to be incremental because Vermont has been a standout. We've got 70% of kids. We're number 2 in the nation for access. We need to improve geographic access. We're at 91% literacy rate for 4-year-olds and 85% overall
Mhm.
for kindergarten readiness. So I'm also curious, what are our end game goals?
Yeah.
And to the point of not upsetting the apple cart, the part we were just talking about merited several stars as I highlighted this report about the mixed delivery system and what will happen to private providers that we depend on. I mean, and we talk about even if more public schools would get into this at an increased capacity than they currently are for more hours during the school day. We're not talking at all about summer yet. What do working families, working parents do with a service that ends on the last day of the school year? So,
And school vacations and, yeah,
Right.
or, right, after school programs, right?
I mean, that's cool. I go into a different program, like there's camps and there's, but transitions are a lot, have much more of an impact on,
not many camps
Younger.
Mhm.
for 3 and 4-year-olds.
Right. So I mean, and that is the thing, right? We would have to, right, our childcare, right? So there are summer camps, the CDD does regulate summer camps for 3 and 4-year-olds. For summer camps for school agers, many of them are exempt. That means they can't draw down childcare financial assistance to help pay for them, but they are exempt from CDD regulations if they run just for the summer period. But not for 3 and 4-year-olds, right? Because there are just some foundational health and safety issues in terms of that we want to make sure are there. So we would need to look at. It might mean we have to look at regulations. There would be a whole other, again, relative to transition, there'd have to be a whole other sort of like industry to stand up. I will say another thing that's in the preschool development grant is working with Vermont After School to do some more analysis related to after school and summer options for pre-kindergarten children. So it's absolutely something that's like a priority for us. It certainly comes up in the After School Advisory Committee, which I think is meeting right this second, is something that we're looking at. Yep. Oh, sorry. That's all right. It's not my committee.
Question.
Go ahead.
So your statements to be careful about not upsetting the apple cart. Would CDD, the agency, be in a better position to be making recommendations after the UPK systems alignment and working with the consultants over the next X number of months? Would you feel that what changes
Yeah,
might need to be made
absolutely.
would be available by the start of the next legislative session?
I think that a lot of them, especially really getting clear on what is the role of the agencies, the school districts, and the programs, I think is one of the things that we've needed to get clearer on. We know that certain, so I think that will be, I think that's a piece of it that will be really helpful. I think looking at, again, some of the places where there's some rubs are related to administration, I think it will get us to what is the data that we currently have and what we really need. I think that there is information that can help us on the funding side of it, but JFO is kind of tasked with doing that at the same time. So I think we need to have that conversation about, but again, we're happy to work closely with them. I mean, on their there's funding study that they early care and learning funding study they just put out. I mean, I read at least 3 drafts of that thing, and provided input for that. So, and relative to funding across settings, what did I feel like I wanted to say one more thing over here? Okay, so we have done a cost of care model with, and again, this sort of came out, again, it's in the pre-K committee report of like, what were the next steps? And one of the next steps was trying to figure out how do we come up with a cost model for community-based programs. And let's see, there it is, okay. It identified that the analysis that we did, that we commissioned with First Children Finance, the national office, its estimate was that the current model doesn't cover between $800 and $1,300 of pre-K costs per child in a typical 0 to 5 program for the 10 hours. Because there is a lot of, there are and that a little bit of that is the teacher's salary, but a lot of that is the time that you need for administration in terms of working with multiple school districts. And as well as some of the developmental assessments that you need to be doing, some of those pieces that you really do need to have staff that have dedicated time to do that work. And do I mean, it's all designed to ideally be like the TS Gold system should be designed to have what you're doing both provides data to the state that's useful, but it also provides useful information to you as a teacher to be able to guide and look at what that child needs. Like, it's not designed to just be like you're filling out paperwork for paperwork's sake. It's ideally designed to do both things at once, but it takes time no matter what. And so that's what that analysis showed. So again, it's just something to consider as you're.
So over a period of time, 800 to 1300?
That would be for a school year.
For a school year?
Yeah. So right, if the current amount is about $4,000, it's saying that it's, at least probably 20% short of what's needed. And again, it does depend on the size of the program, how many pre-K kids you have enrolled in your program, what economies of scale you can get.
Yeah, I mean, in this committee, we won't be determining what's the appropriate amount. We're just hopefully going to say that it should be the same wherever. And I think there is validity to thinking about this, and not in terms of, weighted pupils, because of the complexity of a private and public system. Because that adds complexity, because, if we were across all on Ways and Means, they would say, it's not that the school system is paying more, it's that they have more taxing, that there's more taxing capacity. So I think that one of the things that we could do to simplify one little piece of this is the finance. And I think that categorical aid seems to be gaining some, let's just say. We would not be determining how much that is. I would think that would be added to the scope of work for the consultants who are chosen to do this work.
If I can add to that, to that discussion, I think your perspective is that there's the current structure also doesn't erase this flat statewide tuition rate, and it doesn't, and ideally children that are eligible for early childhood special education are wrapped around. There still is some debates there, but the additional funding that might go to a school district for a child who is coming from a family with limited financial resources or English language learners, right? That's not included in the statewide tuition formula for pre-kindergarten right now. So just mentioning that. And the other thing, I guess I would say, I know that you guys are at time, and it's where we started, and maybe a point of disagreement here is around 3-year-olds. And again, for the pre-K committee report, I mean, I was right, like I co-chaired that committee throughout. I aimed to follow the rules, I promise. And the committee consistently came back to being deeply concerned about the idea that 3-year-olds would not have access about eliminating 3-year-olds from the pre-kindergarten committee. That and like to the point, like we were like, well, what about the thought exercise of it? And it was like, no, we don't even want to think about it. Like, it was honestly where a lot of the committee members were.
What about
like a thought exercise? Like, let's just think about it. Like, what if it was just 4-year-olds? Like, let's go down that exercise. And people were like, weren't even really willing to go down that road because they were really concerned about 3-year-olds. Again, there's places in the state that had access for 3-year-olds for close to 40 years now, right? Like, it's baked into the system that they have. And we're really concerned about that. In the final committee vote at the end, the committee, I think there were 3 people who abstained. No, that's what it was. I think there were 3 members that abstained from voting at that moment. I think, or 1 was absent and 2 abstained. But and one of the people who abstained, everybody else voted like, please keep 3-year-olds in from that committee. And one of the people who abstained because they thought that the statement didn't go far enough, because they felt that pre-K was an entitlement for 3-year-olds. And this one and that the language that we were voting on had to talk about a pre-K benefit for 3-year-olds. So, and again, the conversation, in the report, right, there's feedback from school districts too about their reaction to that and to other people as well. And so I just offering that, like, that's the feedback. It's not just my personal opinion, that really is the feedback that we got through a pretty engaged process. Not just the committee members who were all designated by the legislature. It was the feedback that we heard from schools and the feedback that we heard from community members as well.
Do you have a question?
Not a question.
Okay. So I am recalling some of the recommendations of that report, as well as what we heard in terms of sort of the, I'm trying to remember what the policy recommendations from Building Bright Futures, through their data gathering process as well. And I don't want to put words in your mouth, but what I think that I hear you say is, because everybody has recommended increasing hours for 4-year-olds.
Mm-hmm.
So if the only way that we could increase hours for 4-year-olds was to move 3-year-olds to CCFAP full-time,
Mm-hmm.
I'm hearing you say, don't do that.
Yes, you are hearing
Keep it at 10 hours.
Yeah.
And keep 3-year-olds having the same access as 4-year-olds.
Yeah, yes. If there's not room to expand hours do not expand access for 4-year-olds at the expense of 3-year-olds, partially because of the early childhood special education considerations. But also, again, not every child has access to, is going to have access to childcare financial assistance. Because if you have, they don't all have most of them, many Vermont families qualify from income perspective, but not all of them have a service need, right? If you have a parent that's working, if you have a parent at home, then you're not eligible for childcare financial assistance. So you could be home again with the baby and the toddler, and it would be amazing it would be really good for you and for your child to go to have a preschool experience. Those families, if they have a caretaker at home, they would not have access to pre-kindergarten. And there was some research done, it's older now, it's pre-pandemic, 2019, that those families that aren't eligible, that, said they just wouldn't send their kid if they had to pay for it separately. So that's the part of that concern is you will not catch every child through childcare financial assistance. And especially for those kids that might need extra support, that might need, additional supports. And then I think, again, this is the place where, again, I understand that our education colleagues will have even more to say on this. But I don't know that the trade-off between 2 years at 10 hours and 1 year at full time is as clear, right? Like, I don't know that 1 year at full, I don't think the academic research is clear that 1 year of full-time pre-K is better than 2 years of part-time pre-K. Like, I think there's some research that shows, nope, the 2 years is actually a higher priority than the extended hours for 4-year-olds. And I think, I think that's also part of it too, is I don't think the academic research necessarily backs that up. But again, I am a public administrator, I am not an educator.
Go ahead, Representative Steady.
It's my understanding, like Winooski, they have a brand new school, they got lots of room. But like Milton, we don't have enough room.
Mm-hmm.
We're outsourcing to the few places that there are in Milton that are accredited daycares that can take some preschool kids.
Mm-hmm.
So what happens to the kids that there's no room for?
Right. No, I agree with you I would rather focus our efforts on supporting communities, to build that up. And what does that mean? Does that mean you need to figure out how to have more childcare programs in the Milton area that are universal pre-kindergarten eligible, right? So whether or not that means, and maybe that's by having a more equalized amount for pre-K across settings. Maybe, we do actually have a lot of support, CDD and AOE has some supports as well, but to support people in advancing in their credentials, to support them in getting that educator license, to support them in to support that program and increasing to the required 4 and 5 stars. So again, that's the different. And we can, and there's been some communities that have done that. Like I think Addison County is probably a good example of a place where they created a regional universal pre-kindergarten coordinator across several school districts who really figured out what are the assets that we have in this community for early childhood education and how are we leveraging all of those to make sure that we're creating a positive experience, positive pre-kindergarten experience. And so I wonder about how do we incent that behavior as a tool.
I have a question for you. So one of the things that, became evident to us in discussing Act 76 is, and then looking at the law around Act 166 on pre-K, is that there's nobody responsible for it. It's the only thing that Act 166 does is says the state will pay 10 hours a week if you can find it.
Right.
And so one of the things on the table is, because it is paid out of the education fund, is making school districts responsible for providing or arranging for the provision. So I have a question for you. Right now, it is sort of jointly administered. And if we were actually giving school districts the responsibility in whatever form school districts take in the future, would it make logical sense then to say AOE has responsibility?
I don't want to respond to that question off the top of my head.
I just want you to think about that. If you
I think right now, what the system is designed to build on the strengths of both of our organizations right now. And I think, and one of those things is that really basically, right, is that CDD knows a lot about working with community-based programs and AOE knows a lot about working with schools. And so together, if it's a mixed delivery system, the policy and the guidance decisions need to be made, right, by partners that have expertise in both of those, in both settings. Whether or not there's a place where you're saying, oh, they're the lead, they're the second, I don't know. But I think the other piece to know is, I think from the administration's perspective, we know that children and families are served by both agencies all over the place, right? We're constantly having, working together, right? And whether or not that is within Department for Children and Families, within Department of Mental Health, within a Department of Health, right? We're all working together with Agency of Education regularly. So there's a part of it that's I think we can work together. We already do. I think the other piece of it is that I wanted to respond to your question earlier around the funding flows. So I would offer that families blend public education funding and childcare financial assistance all the time, right? Their school-age children are eligible for childcare financial assistance, right? So they could be using childcare financial assistance for their summer camps. They could be using childcare financial assistance for their after-school program. It depends on the organization of that after-school program. But it's happening all the time, right? Where there's a public education dollar that's paying for part of the day and a childcare financial assistance dollar that's paying for another part of the day for school agers all the time. Pre-K kids are just at that transition point where the shorter part of the day right now is the public education part of it, and the longer part of the day is the childcare financial assistance part of it. But it's the same thing. It's not, I'm just saying it happens all the time. And we do see that blending in the public. We do see the blending certainly in the private settings. But we also are seeing that blending in the public settings. So, yeah,
We had appropriations testimony happening, and I just want to.
got another updated one that said 315.
Will you check, Lori? Thank you. Sorry.
Okay, so I was just saying that we see that right, families are blending it all the time, settings are blending it all the time for school agers. Pre-K kids are also right just at that intersection of that, and it looks a little different because of this mixed delivery system. So I'm just saying, like, there's nothing inherently wrong with that. I guess that's my point. Like, it happens. And we are seeing that public schools, there's plenty of public schools that draw down childcare financial assistance for after school. And there's some that draw down childcare financial assistance to be able to provide after school to their pre-K kids.
So, do you have any sense or do you have any data on the number of school districts tapping into childcare financial assistance, either directly, so money going to the school district, or sort of indirectly with contracts with private providers operating in the school district?
So I do not, in terms of directly, I had the team did pull information for me on the programs that are drawing down childcare financial assistance on their center-based childcare license, which is their pre-K license. And that was like 19 sites. They could be in one school district, right? They could be, it's not within, it's across multiple school districts, but it could be more than one site in a school district. So that is what so it's not widespread, though I also know that there's communities that are thinking hard about expanding it. And I do not have the number.
Amount or
I could
how
get that.
many kids are involved?
We could totally get that.
Okay, that would be helpful. I'm just,
I don't know about the pre-K programs I'm trying to think if there's something in our data set. I could ask the program, our data people about how to get at community-based or private programs in the public school that are using the public school setting. I'll have to see if they have a way to, they probably have to do like address mapping.
part of this is about trying to have a more complete picture for our colleagues about what's actually happening.
Yeah, and that's why, I think that's why sometimes the school age is kind of a good example of being like, it happens all the time, happens every day. But there's dollars flowing from there's childcare dollars flowing.
It doesn't seem to have been an issue for the older kids. It just seems to be an issue for the younger kids. So Representative Bishop, and then we have to move on to our next witness.
I guess I'm curious what we may know or could learn about any school setting that's drawing down CCAFP. What does that look like in their budget planning? I mean, are they? Yeah, that's.
Good question. I mean, but that's, I say good question, but right.
I mean, how much of
school
it is in the
districts-
school budget, and how much of it is accounted for what they anticipate getting through CCFAP?
Yeah, I
It'd be
don't,
pretty challenging to necessarily know when you're budgeting the
Right.
finances of the families drawing down the CCFAP.
school districts have a good idea of their population. They've been doing it a while in terms of knowing their families, but I think, it is, I mean, all budgets are just your best guess. So that's not my professional thing.
Not at CDD.
no. Our budgets are
Finally
perfect.
honed.
No.
So, yeah.
All right. Thank you so much.
Thank you.
Appreciate it. And if you could let us know about, whatever you might be able to tell us about schools accessing CCDAP, that would be great.
Yeah.
Thank you.
Thanks, Jan.
And I think Nicole is on. Hi, Nicole. Nice to see you.
Good afternoon.
No. Okay. Yeah. If, 1, 2, 3, 4, 5, 6. Could you wait? Yeah, okay. Okay. People are needing to take personal breaks for a moment, but we're still trudging on here because we have a time frame that we need to deal with, and I appreciate your patience.
Of course.
Hi, oh, and Christy is just joining us. Hello. Hi, nice to see you. As you have picked up on, we're talking about pre-K and any potential policy changes for the state in pre-K, and really are interested in how that may or may not impact after-school programs. So it'd be helpful to hear from you, what you can tell us about 3 and 4-year-olds in after school.
Absolutely. I really appreciate it. Good afternoon again. My name is Nicole Miller, and for the record, I'm the Executive Director of Vermont After School. We're a nonprofit organization that works to strengthen after-school and summer programs, empower youth, and expand access so that any child or youth in Vermont who wants to attend a program can do so. I structured my testimony today to give a little bit of a refresher because after school is a complicated system, as is pre-K, as is most everything that you all are dealing with in your committee. And then I have some recommendations or some things that I'm thinking about at the end. So hopefully that sounds okay as far as a plan. So just as a bit of a precursor, when we're using the term after school or out of school time programming, what we're really talking about is programming that happens after school, over the summer, during school breaks, before school, on the weekends, sometimes even. And it's really any time that children and youth are outside of home or school. Currently, we're also referring primarily to children and youth who are kindergarten through grade 12. In the current system. And again, that's because there's been a different process for preschool students, and that has been a different process. So the universal after school conversations haven't at this point really thought about pre-K in that sense. But obviously, as I've been talking with providers, those are some of the things that I've been thinking about. So I think, Janet was just talking about a mixed delivery model that's evident in the after-school space as well. So flexibility and mixed delivery are really key design elements of the current after-school system, recognizing that every community in Vermont has a unique mix of resources, partners, strengths, and opportunities, and that families seek out and value those different types of opportunities from various partners, including Parks and Rec and libraries and nonprofits and schools and childcare centers and family childcare programs. In their work and home neighborhoods in order to meet their needs. So when we think about funding for the after school space, because this is going to relate then to my recommendations around preschool or around pre-kindergarten, we're really thinking about the big 4 funding streams. And that feels really exciting as a state that we can talk about 4 funding streams for after school. So I just want to name and celebrate that. But we're really talking about 2 federal programs. One is the 21st Century Community Learning Centers funding that comes through USDOE currently to the Agency of Education. And then, as you all know well, the Child Care Development Block Grant funding that goes through the Child Development Division. You all also know very well about Act 76, your hallmark program bill and legislation that you all have worked on, as well as Act 78, which are the state after school and summer funds, which are administered by the Agency of Education. In addition to that, after school programs are using a wide range of other funding. So local funds, both originating from school budgets and not, municipalities, program participants and family fees, private grants and donations, and other federal fundings like Medicaid, title funds, basically any dollar that after school and summer programs can find that meets their needs is what they're employing, quite frankly. And there's a big overlap between those program types and funding sources, right? So a licensed after school program could also be a 21C funded program. A nonprofit that runs a licensed after school program could also have
21C, Nicole.
Oh, I'm sorry. 21C is 21st Century Community Learning Center funding. So that's
Okay.
that federal funding stream. I apologize. That's a shorthand because it's such a long name.
Mhm. Well, we're not the education committee, so sometimes we don't know all of these
I
things, so.
appreciate you naming that and asking the question. So essentially, it's just a complex space, especially because we're thinking about K through 12 in the current system. As you all know, licensed dollars are really available and flexible for elementary age children. But for middle and high school, that's a little bit harder because they don't fall into those age ranges. And so, that's where we see a lot of other different funding sources coming into those spaces.
So you just said, Nicole, K through 12.
I did.
Can you elaborate a little bit more on what do you see across the state in terms of after school for pre-K age kids, so 3 and 4-year-olds?
Yeah. I think my concern is that the system right now is not set up for that. And not that it shouldn't be done that way. I'm just naming that it's a tension point. So for example, within the 21C funding, so it's that education funding that's coming from the Department of Education, it is permissible and allowable to use those funds to serve preschool or pre-kindergarten age children. There is one site in Vermont out of 94 that is using those funding sources to serve pre-K. I also think a lot about the structure and the differences between, even in licensing, the licensing regulations are different for school-age children versus those who are under the age of 5. And wanting to make sure that after-school programs that are currently running would be able to adapt to those processes, I think that there would be some work needed in order to do that. So those are things that I'm thinking about. I also think about the capacity. The after-school space has a hard time finding staffing because it's part-time hours for the majority of the year. And wanting to think about, would there be professionals available to fill those additional staffing needs, knowing that they would, instead of being full-time at like their local childcare center, there would be some changes in how their work looks, as far as, the typical hours for any after school would be, 2:30 to 5 p.m. So those are things that I think about. I also think a little bit about facilities and whether or not the facilities are set up, again, for school-age children or for those that are in pre-kindergarten or under the age of 5. Those are really the main points that I think about. Again, I want to show that these are really intricate systems, and if you make one change to pre-kindergarten education, it's going to have an impact on the after-school space, vice versa. And just knowing what some of those implications are is really my role, is to just share what some of those are.
Thank you. Thank you. Any other questions for Nicole? And I think that what I'm taking away from what you're saying, Nicole, is just like we heard from the previous witness, these systems are sort of interconnected, and while you don't have a lot of after school programs serving pre-K kids right now, that doesn't mean that there won't be a future where that's the case. To think about how anything we might do now might impact that in the future.
Absolutely.
Great. Any other questions for Nicole? Thank you for waiting. We were a little late because Janet had us enthralled with so many questions.
Understood.
All right. Thank you so much, Nicole.
Thank you so much, you all. Appreciate it.
You're welcome to stay on. Christy, welcome.
I'm Christy Swenson. I am the director of Capstone Head Start, which serves Lamoille, Washington, and Orange counties. And I'm also the chair of the Vermont Head Start Association.
So, Christy, I see you have some information on our website. And what we're also really interested in is maybe a brief overview of how Head Start interplays with pre-K, and then, also maybe to a little bit lesser extent, the CCFAP. We have some decision points ahead of us. And so how would a potential change to 3-year-olds being CCFAP only and Head Start, or how would that impact programs, or how would increasing hours of pre-K public funding impact 4-year-olds, or, I guess potentially 3 and 4-year-olds, And so if you could just maybe describe a little bit the sort of interplay between Head Start and the public school funding and system, that would be great.
So I think I'll kind of start out with providing a little bit of context
Great.
for what Head Start is. So we are a program that our mission is to serve those young children who are the most at risk of being behind when they enter kindergarten. And so that means that we prioritize children based on whether they're likely to be behind at kindergarten. And those, like as an example, our wait list is not based on how long a child has been sitting on the wait list, but rather we have a point system, and those the most at need jump the line to go to the front of the wait list and get in first. So that really is our mission and what drives all of our work. We operate on a 5-year grant cycle, and preceding each of those 5-year cycles, we do an in-depth community needs assessment. And based on that assessment, we take our service area, the number of dollars the Office of Head Start will give us, and determine how we can best address those community needs with those dollars that will be made available. And so what is very different about Head Start programming is that the core of what we do is early childhood education at a very high quality level, but it is only one of many things that we do. So we also are providing, making sure that children have all their medical, dental, nutrition, mental health needs met. We also are making sure that children are in stabilized families, and we work to stabilize those families, because what we know about children in this age group is that they cannot attend and learn if they don't have a safe home environment and a belly with food in it. So that is much of I'll say that's our philosophy and the way that we operate and the way we're mandated to operate. As far as how we interplay with UPK, I believe that all 7 Head Start programs in Vermont participate in UPK. So we are intertwined in that way. The other way that we're intertwined is that a lot of folks don't understand that Head Start isn't federally funded to provide all the services we're mandated to provide. The expectation is that those basic early child education services are provided by a mix of CCFAP and state funding. And then we're layering on the high quality for early childhood, which means we have a coach on staff to make sure that teachers are doing a great job. We have research-based curriculum that must be followed to fidelity. All of those things cost money. But in addition to that, we have all of those wraparounds for the child. So, we have a registered dietitian consultant. We have multiple mental health consultants. We have nursing consultants. We have dental consultants, so that we're looking at all of the health needs of the child. And then we also do a whole lot of work with families in as far as providing parent training, identifying goals, whether that's that maybe they want to go to college, maybe they want to have more stable housing. We help them work toward those goals in an intensive way. We have 1 staff person to every 35 children enrolled that is solely working on family services.
And that seems to be, that's a key difference between pre-K by itself and Head Start, is that you work with the whole family. And also, as I understand it, having visited your Capstone site at least, also provide education to parents and, GEDs and teaching and all of that. So, I think the wraparound nature for the whole family is something that is unique to Head Start. Excuse me. Which is very resource intensive, I'm sure.
Yeah. And so what that means is that we are dependent on those UPK funds for our current model of how we operate. All of us are. I'd say there are 2 things that would be big impacts for us were what we're doing with UPK to change. One is if we no longer are getting that additional funding for 3-year-olds and the majority of 4-year-olds are going to the public school system, then that necessarily means that we would need to reduce the number of slots we can provide, because we're mandated to provide all of those services. So it's not like we can't reduce quality because we have less income. We have to reduce the number of children we can serve, which is not something we want to do. The other thing that I'll say for 4-year-olds is that the majority of the 4-year-olds my program serves, that's the program I can speak to, would be fine to move into the public schools, but there's a subset of 10 or 15% that really need those family services and really need those intensive child supports in order for them to be successful. They're not ready to move into the school system yet. And I would worry about that subset population getting their needs met.
Do you think it's important for, I don't think that we're, it seems pretty clear that what we want to maintain is a mixed delivery system that allows private and public as being best practice. And so how do we support that? And, I think that I'd be interested to know from your perspective in Head Start, we've uncovered some equity issues in terms of access. And you mentioned a waiting list a little bit ago, and I'm just wondering, did you say that you maintain a waiting list? Do you know if those children access any other supports while they're waiting? So do you know if they're accessing, CCFAP, or if they're accessing some form of maybe public pre-K?
Sometimes we know and sometimes we don't know. So we do work with them to try and find them some supports while they're waiting, particularly if they're really looking for a center-based program. Sometimes we can put them in home-based, and then we can be providing all of those wraparound supports while they wait to get to the front of the wait list. And our family services workers are well aware of what other opportunities are in our community to help them with that piece. I wonder if I could speak a little bit to the whole system.
Yeah, it looks like we have one more question, the Representative Cole.
Oh, yeah, my question relates to the whole system as well. Maybe you'll talk about it, but about just how new restrictions in HR 1 are impacting you or will impact you if they haven't already.
So I guess that's a big unknown for us. It feels like it's a big unknown for a lot of folks because, particularly the Medicaid piece, I've been asking folks at Department of Health, to try and figure out like what we think those long-term impacts have been. And I've not been able to get answers yet. What I keep hearing is we don't know yet either.
I just want to be ready and prepared as, because that's our job, of course, here in Spain. So it's hard to not know, of course, from every angle, but yeah.
And we know there were threats early on to
Yes.
Head Start that luckily didn't come to fruition. But
Right. And we're not feeling that right now. There is some behind the scenes dismantling of some of our systems, but we're not seeing, it's not where we were a year ago when they wanted to just eliminate Head Start. There's no discussion like that anymore.
that's good. So yes, please speak.
So as far as sort of the whole Vermont ECE system, I really want to speak to how well it's working right now. I really feel like folks are making use of it. I feel like our outcomes are great. I think we always want to be thinking about continuous improvement, but I think we want to be very cautious as we're doing that right now because what we have now is working well. So being very mindful about unintended consequences. I think it would be wonderful to expand services for 4-year-olds, but it can't come at the expense of what 3-year-olds and families with 3-year-olds are receiving. So I think we need to be mindful of that. And also, I think we have to make sure that we still have that mixed delivery model because we need a range of service providers because we have families and children with a range of needs. And so, we need to be able to meet the needs of kids and families. And I wanted to just say one thing about small business owners who are in this field, which you guys have probably heard this 50 times already, but I'll feel remiss if I don't mention it. That for these small business owners who are running these centers, they're very dependent on the funds that they bring in for 3 and 4-year-olds because they lose money on their infant toddler. I mean, they're private businesses, but they're doing infant and toddler classrooms as a service to the community because they lose money on those. And so we need to be very mindful as we're playing around with funding for 3 and 4-year-olds that we are not unintentionally causing problems for those small business owners and ending up unintentionally reducing overall slots when we've done so much work to expand the number of slots that we have available.
I think one of the things that I think this committee has probably had particular concern about is the differential in the rate of education payment for pre-K from private pre-K, versus public school system. And, that's one piece of the equity system that we'd like to address. Are your teachers licensed teachers? In others, do they have, and I don't know if Head Start's required to have licensed teachers, or are they licensed in the classroom, or do you just have sort of overall supervision by licensed teachers?
So no, they're required to have their bachelor's degree, and the majority of them do also have their ed license. Not all Head Start teachers, but most do.
Mm-hmm. What kind of transition period, if that were to be a requirement, do you think would be reasonable?
Transition to
being licensed?
I can only speak to my program. I don't think it would be a big lift for us.
Mm-hmm.
I can't say for other programs sort of what their specific staffing situation is.
Since you already have a requirement for bachelor's, that's probably not the situation for all private providers.
Correct.
Yeah. Other questions for this witness? Thank you so much for taking time away from what, as I know, is a very busy place. With all those little ones running around.
Thank you.
And thank you, Christy. Appreciate it. It's nice to see you again. Okay, so what we've heard, and hopefully, Lori, can you tell me if we have been successful in AOE doing this? Okay. Okay, so tomorrow we are going to start with some very, very draft language, hopefully. I haven't seen anything yet, but we will have Katie and Beth St. James here in the morning. We're going to start the day, though, with Representative Burrows. No. Oh, okay. All right. Well, stay tuned, I guess I'll say then. It's a fluid agenda, that's for sure. So what are your just reactions and thoughts, not only to today's testimony, but what we have heard from NEAR, what we heard from Building Bright Futures, what we heard from JFO. We haven't heard from the education side of things yet, and we'll get them in here. Not sure when, but
I had no idea it was that much of a, polygon or whatever. All these threads, all these, wow. Kind of a hard thought to untangle it.
I agree, the intertwinedness of
Yeah.
how everything has kind of organically evolved.
yeah.
Listening, especially today, but trying to think about everything, it strikes me that where my brain is that I'm really intrigued by the notion of these two agencies and a nonprofit working together for this. And the practice of doing that is not simple, and just making sure that that's well in place in order to go forward. And it seems like we're going to get so much more information soon-ish, that to make a substantive change or a pretty significant change might be tricky, given the changes that are coming in Act 73 and also in the report that's coming. It just seems to me we need to I would feel really comfortable about setting up a system that can really grow and deal with all this, and then we can provide good oversight as we go forward. But to make changes right now, just because it seems like the thing to do, I can't think of one that would, except sit down and figure out how to get the access across the entire state, really solve that problem somehow. Um,
Yeah, I mean, I
It
think
seems to
that's,
me that put that as a task, but maybe not that with specific goals, but that's the first task. And then start arranging if we need to down the road a bit. That's where I am right now anyway.
I think just based on what we've heard so far, I think we can make progress towards the funding, equalizing the funding. So that would be a big step forward, I think. I have big concerns about the 3-year-olds and 4-year-olds. I think, I've shared this before. It's, given that we have just stabilized, and this is not a surprise, I worked for CDD, but just we've stabilized the whole system just such a short time ago. And we have, we're just kind of getting going on stabilizing capacity, increasing credentials, because we have a lot more incentives out there for professionals. We're getting more people interested into the field. We're getting more family childcare programs that want to start businesses. So I just really, really worry that disrupting that right now, especially given that we have this information that's coming based on the PBG grant and the consultants that are going to be working on this. I just feel like it would be really premature for us to do that piece of it. But I'm really encouraged that we might be able to make some progress on the funding, equalizing the funding. So childcare programs are receiving the same amount of funding that schools.
yeah, I like that.
I would say I've probably been fairly transparent on my thoughts as we've gone along with my questions, and I would just really probably second what Rep. Garofano has said. And to a degree, what comes to mind for me is sort of with some questions left open. I'll take sort of two analogies or borrow from the medical field. One is the Hippocratic Oath: first, do no harm. We have a system that's working quite well. And then the second, I think, as Representative East is saying as well, we're getting more information and we can act more surgically, I think, in making some changes and fixes once we have that information.
I think it seems pretty clear from all the witnesses we've heard from so far. I don't anticipate AOE being any different, given the Pre-K Implementation Committee report. Although that was just, I remember if Secretary Saunders she was just barely here. Yeah, just coming in when that came in. Even if we have to leave even if we are not able to expand 4-year-olds, that it would be better to leave 3 and 4-year-olds as part of the mix for pre-K. That seems to be, pretty consistent from what we're hearing from all of the witnesses. I think we are also hearing that equity and access should be one of the first things that we tried to tackle. And I agree with Ray that I think we can make progress on the equity of the payment. And I think we can simplify that, or at least propose a simplification for that. That would be a big help. Which would be a big help, I think. Yeah. On the governance, we heard from DCF that, they think it's important to maintain dual governance, and we'll hear what we hear from AOE. We'll ask that same question when we talk to AOE. I think it's interesting that I don't know how many of you, in your school meetings, when you've gone to school meetings, I continually hear about pre-K as an unfunded mandate, which really surprises me. And I also continue to hear about it in my school districts. and this is, I will say, from upper level teachers, high school teachers, about the, perception it's not education.
It's babysitting.
Yes. And, you know, it's not not necessarily something we can change here, but I think it's something that sort of the system needs to work on. And, you know, I do view AOE as being sort of a responsible entity for helping to change that dynamic.
Our Senate bill that might come to us also will help with that.
Yes.
The professionalization.
Yes, we were not going to talk about that one right now. No, but they're talking about even within the school system where they are, where they have licensed teachers. There, you know, the concept that it's an unfunded mandate and when it's not, is just an interesting dynamic. And I don't really, you know, it's not really something for us to deal with, but, I think it is something that the education system as a whole needs to, I guess, underscore the importance of early education and the benefits that it pays off. And I would look to that system, you know, that system is clearly producing results, you know, kids are arriving at kindergarten ready to learn, a very high percentage, they're motivated. And then, you know, we don't maintain that over time. Yeah. Okay, well, we're just in discussion. Yeah.
Yeah, I would say in my time working at the Greater Burlington YMCA, I came to bristle whenever I heard the term daycare. Because at a minimum, it's early childcare. And I think early childhood education is appropriate more often than not, even if we're not talking about a licensed teacher in a classroom. We are the STARS program and other things that we do to ensure high quality really push Vermont ahead of many other states to ensure that there is benefit other than just someone's minding my kid while I'm working. So I think even here in this committee, keeping in mind that, you know, it's early child care or early childhood education is what we are getting in Vermont. And we're fortunate for that because it is yielding great results. And I'll just add on a data point with, and I think the conversation has moved in this direction of what we've been hearing from the witnesses, the 3 and 4-year-olds. I think I would have to imagine we're getting a 91% literacy rate, or meeting literacy for 4-year-olds, in part because we've got 3-year-olds engaged in the program.
Yeah, I think that's a good point.
Yeah.
I think that's an excellent point. And I you know, I guess we're not in the education committee, but I think that maybe, you know, I realize that education at different ages is different. But it seems as though some cross-fertilization of methods that are successful with young children, particularly as our, you know, the assessment results definitely change by the time you get to 4th grade and then again by 8th. So, yeah, Brenda.
I was on the school board back then. That's how old I am. And I did have a parent approach me, and it was really odd, at a local store, screams at me, "You better vote for that. I need daycare." And I'm thinking, wow, I wouldn't be voting on it to give you daycare. And he was adamant, "Give me daycare." And it was like, it wouldn't be for daycare, but whatever, I was polite to him. And then has anybody ever done a study of the dropout rates have increased since this all started in 87? Well, 85 we started. 84, I was on the committee to get kindergarten into the system. So that was 84. So 87 for the preschool. Has anybody done a study? The dropout rates are really high right now. If it has anything to do with kids getting sick of school. By the time they get to the high school level, it's like, hey, I've been here since I'm 3 years old. I'm done.
Yeah.
And the dropout rates are a lot higher and we're losing kids right and left. Has anybody ever done a study about that?
That's a question you can ask Secretary Saunders when she's
Thank
here.
you. That's a good question because, yeah, the dropout rates are huge.
Well, one of the things, if you notice on the Head Start data elements is
Yeah.
the rate of high school graduation is one of the things that they actually measure. for
Yeah.
students. That means they followed them for a long period of time.
Right.
Which is, probably more than any other system, I would say, in terms of that kind of information.
Well, they've been around for a while too.
It's been around for a while, yeah.
I must say that, nothing I've heard yet has steered me away from my own gut saying, I mean, kids are really different at that age, their maturity, all those things they need. They do better in different settings, and the idea, the importance of the diversity of the system, the mixed delivery.
Mhm.
system. Some things aren't right for some kids and vice versa.
Right.
And, having those options, I think is really important at this age and phase.
I did get
No, please.
concerned after listening to the representative from Head Start. It would probably affect them with their funding and everything if this went through, take away from kids instead of helping them in that area. So there's a lot to think of
Mhm.
for the child.
I'm good.
Nothing?
Yeah,
Okay.
thank you.
So tomorrow, we'll be seeing some draft language, language that, we, based on our conversation here today, will pretty much tear apart, I'm pretty sure. I think it is good for us to be thinking about how we can increase equity, in making pre-K accessible, to all who we end up recommending should have it. What kind of time frame that would require. I think that what we will end up with out of here will be some fairly simple language, I think. It'll wind its way through, it'll go from here to education, where they're going to add a bunch of other stuff to this bill. And then Ways and Means and Appropriations. So I think that while we heard a lot today about the sort of intertwinedness of all of this and the complexities of it, I think that there are elements that on the surface can be relatively simple that we can, one, confirm or reaffirm, I guess, and two, some couple of places where we can make some movement toward doing our best to ensure equity to access this service and simplifying payment. I think that we can figure out ways to do most of those things, and probably also make some recommendations around qualifications of people who are in the classroom. Because one of the things that we have to keep in mind, that if we are going to provide additional payment on the private side of things, then I think we do have to answer the question about licensed teacher in the classroom. But allowing lead time for that to occur. Yeah.
Just to clarify, question, when you talk about increasing or improving access, I'm understanding you to mean geographically.
I am,
Okay, just to be really clear, because we don't want anybody to think, where it's available, right? In a lot of places, yeah.
Right.
Yeah, and
right.
there's pretty good access in some places, yeah.
In some places, as we saw,
Yeah.
but then we also saw in some places
There's
where
none.
Nothing.
Yeah.
where there's, 11% of the kids.
I just want to be real clear, thanks.
I would just share, I'm a little concerned on how it would play out with respect to requiring a licensed teacher in all settings in the classroom, not just monitoring the program, if you will, whether the realities of the workforce can meet that, and would we inadvertently be doing harm to our mixed delivery system?
Yeah. I don't have those concerns myself. I mean, I think with ample lead time, we have a lot of people, as we heard from the witness, that we have opportunities and payment for people to, if they want to. And a lot of the center-based programs have already moved in this direction. And you can't double the payment they're going to receive and not have that expectation from my perspective.
Right. I agree with that, yeah.
That's And I don't think it's fair to not pay the same, to not have the same payment. Because that does influence what you're able to provide in the classroom. We can't pretend that it doesn't.
I just, as far as access goes, I just wanted to reiterate something we heard from testimony earlier from DCF, from the Deputy Commissioner, is that one thing that we can really leverage is kind of thinking about targeting the areas where we need to increase access and helping bolster the mixed delivery system in like having centers or smaller programs become UPK qualified. So it's not, we're not just relying on like the schools, that we're building like really good partnerships in those areas, but like having a targeted approach and understanding where the need is and having the the responsible agencies working with those communities to figure out how can we leverage the incentives that are, because we have all these incentives with stars and credentials and all that to help those areas develop better partnerships so there's more access for pre-K in the private setting when there's no space in a school.
Yeah. And I know, for instance, we're going to be getting a bill from the Senate that talks about enabling access in New Hampshire for particularly in the Northeast Kingdom, where it's the only place where they have access in some instances. So, okay. We've had some good testimony today. They all seem to be building on one another. I mean, I haven't heard anything that is distinctly different, from any of our witnesses that we've heard either previously or today. I mean, people seem to be on the same line, almost as if they got together and said, let's talk about this. No, I'm just kidding. But they do talk. I mean, I think that, we will, like I said, get some draft language tomorrow. We can poke holes at it, make changes. We still have to hear from AOE. And I think that hopefully we can get AOE in here so that we can have something voted at committee by Thursday. I still would like to stick to that time frame if we can. Do our part. Anything else? Okay. Thank you very much. And if you're interested in going down to appropriations, two of our colleagues are down there explaining H 938.
Oh.
Okay.